Cheryl Bill. Weathers.
Odie Martinez.
Happy to have you with us. Thanks for coming back and joining us. My background is in recovery coaching, and our focus each week is on addiction and recovery, primarily from a psychological perspective, because that's my own professional background. And I've got Odie to keep it real.
Yes, I keep it real.
You keep it real. Right on, right on. Speaking of keeping it real, last week we had a guest, Dr. Cheryl Bildner from New Hampshire. She's a dear, dear friend of mine. A clinical psychologist doing really innovative work in online approaches to treatment of addiction disorders, and also talked at some length into the use of medications to assist that treatment, especially in saving the lives of those that have been addicted to opioids. And so it was really wonderful having Cheryl on board with us last week. A lot of positive responses during her presentation. She was in New Hampshire, we were here in Southern California, and we had a dialogue going. And then a lot of follow-up this week by a lot of people that have viewed that video and found it useful and inspiring. A lot of people who themselves have survived addiction thanks to the assistance of medication. So hats off to you, Dr. C, and we'll have you back again as a guest. Hats off to Boulder Care for what you're doing on a national level in terms of providing assistance to people that otherwise become a statistic. And the statistic, as we talked about last week, is very disturbing, alarming. And really glad to have you with us and glad to support you. You'll be back with us again, Dr. C. What we did 2 weeks ago is we introduced the topic of hope, and I don't think that's unrelated to last week's co-presentation with Dr. Bildner, is that there's a psychotherapy researcher of note, Jerome Frank, who summarized why people come to see a therapist. And he says what cuts across all diagnostic categories, so whether somebody's anxious or depressed or perhaps has a struggle with addiction, is the one thing in common across all clients that come to see a psychotherapist is that they've given up hope. And they've given up hope of whatever they've tried to do, go to family, friends, for support, and they've exhausted that and it's not working. And so typically that's when they'll go to see a professional counselor. Dr. Jerome Frank referred to this as the demoralization hypothesis. People get demoralized, we get demoralized, and we give up hope. And that loss of hope ends up being not only a common denominator for getting us to seek help, but also can be a common denominator for things getting worse in terms of flat out giving up. So we're going to look at restoring hope as an antidote to giving up today. We introduced that 2 weeks ago. We're going to follow up by a quick review of where we were 2 weeks ago, and then go where Odie and Bob go today, okay?
Sounds good.
Want to invite all of you to feel free to submit questions as we're moving along. You can do that through the Facebook group, Ask an Addiction Specialist, and Austin Armstrong, who's producing everything online today as we're here in the office. He will be happy to field your questions and forward those in real time to Odie and me, and we'll do the best we can to address your questions. So I want to invite you to feel free to join us in dialogue. That's why we didn't finish the last time, is that we had tons of interaction, and I hope that you saw Odie's and my enthusiasm, because that's really what we're most interested in, is we can create a dialogue not only between Odie and me and Austin, but also with you all live in our audience. It's great. So please feel fully invited to engage with us. Okay, so by way of quick review, or not so quick review, we've looked at the role of shame in not only as a setting event for addiction. In other words, it sets up addiction for many people, but we've also looked at it as being a primary trigger for relapse to addiction if one is in recovery. And by shame, we've talked about it simply, I'll use a short definition today. It's that feeling that there's something broken, defective, not okay about me, and in fact quite hopeless about me. And so you'll see right away the connection between shame and hope is that shame has the capacity to throw a wet blanket over hope, and we'll give up hope when we feel like that there's something broken within us that cannot be fixed. We provided an exercise a couple weeks ago to ask you to reflect for just a moment on when you've experienced shame within yourself. That is, when you felt like that there's something broken within you that separates you from others, that limits you, and there's nothing that you can do about that. So we asked first to look at that, how that goes internally, and then we talked about, we provided an exercise, a companion exercise, to look at what it feels like to have others give up hope on us, where you can look at somebody's eyes and you know they've given up hope. This cuts close to home. I just came from a group at Beginnings Treatment Centers here locally, who are our sponsor for today's presentation. Thank you, Beginnings. And I'll oftentimes bring this up in groups where I'll ask people, do you know when a family member looks at you and they've given up hope for you to be able to change? These are individuals who've experienced severe addiction, oftentimes to heroin or methamphetamine, and have, in many cases, experienced multiple relapses. And they say, yes, absolutely. I can tell when mom or dad, husband or wife, my partner, my child, when they've lost all hope. And so in our exercise 2 weeks ago, we looked at what this feels like. I keep pulling the cover off of our table here. Just so excited about this topic. What it feels like to have the people that matter most to us giving up on us. And it's hard, even though it's understandable, because oftentimes by the time people that love us have given up hope, that is, if we're in active addiction and or seeking recovery, they've experienced so many disappointments, so many frustrations, so many betrayals of trust and so on, that it's understandable that they give up hope. But it's a crushing blow for the individual who's sincerely seeking recovery. Let me say a word about how it is that shame banishes hope. If you think about shame, which looks at me as being worthless, hope would hold out the possibility of my being worthwhile, of my being redeemed, of my being able to turn things around. And in this sense, hope is the opposite of shame. And if shame has a grip, if it has a toehold, like I do on the cover of our table here, if shame has a grip on us, it will actually quash or eliminate hope. Is that it will convince us that there's nothing worth redeeming. Does that make sense?
Yeah.
You can see I'm looking at you, and I know of your faith. Is that you can see why hope is so central to spirituality. Is that if the hope, for example, in a Christian context, if the hope is to be redeemed, and I perceive myself as unredeemable, then there's no way for grace to enter in, right? There's no way for forgiveness to enter in. And so the same for us in any domain. Here in our focus on addiction, addiction is such a devastating disease, not only to the individual who's been trapped in addiction, who's been enslaved by addiction, but also by the family members, that you can readily see how hope can be chipped away to where there's nothing left except for a sense of hopelessness. We moved, 2 weeks ago, we moved from talking about the relationship of shame and hope, how shame is related to recovery, how it's related to addiction, and how instrumental hope is for being able to turn the tables, turn things around, is that one of the qualities of shame is that it creates for us an outsider's perspective on our experience. And what do I mean by that? If you've experienced somebody looking at you and giving up hope on you, typically they've lost contact with your soul, with what's inside of you. And it's just as easily possible that it's us who've given up on ourselves, that we no longer have contact with our souls. But in that state of mind, then, we're only looking at ourselves externally. There's no interior. There's no interior Odie. There's no interior Bob. So no one understands our motivations, our mixed feelings about things, our struggles, our disappointments. When I talk to a group of individuals early in recovery from addiction, most of whom have had repeated relapses, they look from the outside as being losers. And they'll say, people look at me as being a loser. But when I talked to them, in fact, just today, when I had a room full of people in that group today that, for the most part, are committed to changing their lives and have actually learned from their most recent failures. And so they're not at all static. They might look like they're static, like there's nothing changing. But in fact, they're folding in their latest experience of relapse into what must I do differently this time to succeed. And you wouldn't look at that from the outside. If you look from the outside, you just see somebody who's once again exhibited addicted behaviors. But from the inside, something's changing. And it's imperative that we look inside. Well, shame only looks on the outside. Shame only looks at your behavior. And so if you've experienced somebody who looks at you from the outside only, or experienced that with yourself, then you know what I'm talking about. And in that state of mind, it's hard to find hope. It's like we reduce ourselves down to the image that I shared of the experiment that I did when I was in third grade of pinning butterflies to a black velvet mat. And as beautiful as butterflies are in the wild, by the time they got chloroformed and pinned to a mat and labeled in Latin, they had lost their butterflyness or their dragonflyness, and they were reduced down to something infinitely less than a butterfly. I mean this somewhat figuratively, but they had lost their soul. The butterfly no longer had a soul. It was just an external object. And even as an 8-year-old, there was something very upsetting about that to me.
Yeah.
How does this land so far? How are we doing?
Doing good.
Doing okay?
Yeah.
Okay, so we're summarizing kind of where we were before, and we're getting close to where we left off.
I did want to touch upon something that you mentioned. I don't know if we're going to go over this further on, but when you mentioned how sometimes loved ones lose hope, and in someone that's an addict, and that just continues to kind of have that vicious cycle of addiction. I think I feel like sometimes, and you correct me if I'm wrong, but I feel like sometimes when somebody that you love the most, they lose that hope, I feel like that's when the change starts to happen more rapidly, instead of kind of through a trial and error process. I feel like it's just like my back's against the rope. I need to do something like now,
Thank you for that, Odie. I find most often with the individuals I work with, the men and the women that I work with, that they'll talk about something like that. Their back was against the rope. Most often it's a relationship. Most often it's the loss of my partner, my boyfriend, my girlfriend, my husband, my wife, my child, my parents, my boss. Most often it's a relationship that motivates it. What do you think that is? What is it about that, the loss, kind of, as that person you care so much about loses hope, that actually there's the greatest incentive there, or can be? Any thought?
I think it's just kind of that maybe that's used as a if I do this, if I get clean, or if I correct my behavior, maybe there's a chance that they'll accept me back. I think that plays a role in it, but for the most part, I feel like maybe it's also kind of a preventative thing where, okay, I may have lost them, but I don't want this to happen again, so I think I'm going to change this right now.
You remind me of something I've been thinking about a lot lately, and it's something that I haven't thought about as much before, but I'm thinking about it. My training in psychology, we have so much focus on what motivates us are positive incentives, like positive reinforcement. But there's another thing that also serves as a very powerful motivation. It's kind of the complementary opposite. And this is what I've been thinking about more lately. It's what psychology calls negative reinforcement. Negative reinforcement is the removal of something that's really painful.
Right. Yeah.
And so just as you can add something positive to motivate me to do something, if you can promise to remove something, or if there are holes promised that something might be removed, for example, the disapproval of someone that you love dearly,
right,
that you might be able to regain, that would be the positive, but that you might be able to change the state of affairs in terms of moving out of that. It's so radically unpleasant to experience somebody giving up hope or rejecting us. I see there's a comment, I'll get to that in just a moment, that I've begun to realize that if you can help, this is how I think about it, if I can help clients of mine when they're facing the possibility of, in the case that I'm working with clients primarily who are addicted to substance, alcohol and other drugs, if I can help them to begin to feel what it's like to use whatever they use, but the cost that is to them. We just talked about this today. The cost that is to them in terms of relationships, jobs, careers, reputations, finances, you name it, is to hold that in mind, is to put it in popular parlance, is to really harsh the buzz. It really affects the buzz to realize this is what I'm getting ready to do. I'm getting ready to sacrifice this relationship. And it doesn't always work, but it's to hold that in mind. And there's another resource that I've come across that refers to this process as disenchantment, is that I begin to feel disenchantment with whatever it is my addictive behavior is because it costs me so much. Does that make sense? In the context of what we're talking about, the loss of a relationship, to really hold that awareness. What does it feel like to have my wife look at me with disapproval?
Right.
To hold that inside, it doesn't feel good. It causes me great sorrow, great pain, causes her great pain. And then to put that right up next to, well, I feel craving right now, craving to use whatever the addiction is, and to remind myself of how much that costs me, what that feels like, is it moves towards, again, disenchantment. It takes away the enchantment of the addiction, or at least it knocks it down a few notches, holds out that possibility. I've begun to believe that part is as important as all the positives that come from being clear and clean from the addiction. Is that the dark side of it is worth really holding in my memory and my awareness.
Right.
I'll oftentimes talk to clients that will say that's one of the values of going to support groups, because the support groups will talk about what was it like to hit bottom. And hitting bottom for individuals oftentimes is where there was a relationship that was ruptured or even lost, and it, on the one level you could say, and I've heard people say this, it's depressing to go to groups like that because people are talking about really horrible circumstances.
Right.
On the other hand, it's a way to kind of collectively hold that suffering in our awareness with a commitment to not wanting to repeat it. Does that make sense?
Yeah, I can relate with that too, because when I was going to the groups for SA, sexual addiction, you know, I was hearing these stories from other men, and I was just like, okay, if I continue on this road, unfortunately, this is what it might look like if I continue on this road. So I think that just alone was just like eye-opening in itself.
Yes.
And furthered the feeling of, okay, I don't want to do this anymore. You know? I think that's spot on.
You know, thank you for sharing that. And there's this idea in active addiction that active addiction is primarily a midbrain phenomenon between my ears, and that the forebrain, the frontal cortex, which, for example, makes long-term judgments like what you just said, looks at the long-term consequences, that it's really compromised, especially when we're really active in addiction, whether it's to a behavior or to a substance is kind of irrelevant. And the good news is that there's I've talked about this even recently this week with clients. Even in active addiction, there's still some small voice in there that doesn't want to use, and oftentimes that will go away as soon as the addictive behavior kind of kicks in. But if you can appeal to that, and so you talk about, even if I'm craving and right on the verge of relapse, and I can hear your story to remind me of what will happen if I follow this through.
Right.
It's just possible that there will be some traction with that still small voice, and that'll be enough for me to resist the impulse.
Yeah, exactly.
Yeah. It's one of the values. Let me check and see. There's a couple of comments up here. The first comment is, can you say anything about keeping hope for someone you love who's still in addiction, but also drawing a line or healthy boundaries so you don't get hurt by their behavior? What a great question. I'll tell you, I'll answer this based on a group I was in yesterday. I was in a group that I was facilitating yesterday, and an individual in the group said, and I think he was saying it slightly tongue-in-cheek, he says, I've just learned to be apathetic. And I sat there for a minute, and I actually began to boil a little bit, because this is somebody who's further down the line, and there's some really people in very early recovery, and I felt like the choice of the word apathy would certainly be less than inspiring. It's like, the goal here, Bob, would be for you to be apathetic. I thought, no, I'm not going to be okay with that. And so we worked with it a little bit, and it ties into this question. I'll tell you how I responded. Is I think the goal is not to not care, which would be apathetic. It's to care, but to care holding things lightly. And so I prefer the term non-attachment. There's a lot of work in psychology on being dissociated, just dissociating. And sometimes that synonym for dissociation is the word detachment. I just detach. And I would think of, in this case, synonym for detachment would be apathy. Apathy, not caring; detachment, not caring; dissociation, being checked out. And I'm not advocating that. And I think all of us have experienced that. Sometimes we hurt so bad you just want to detach. I just want to cut off the feeling. In fact, I feel like detachment is a kissing cousin of active addiction. Because in active addiction, I experience being more dissociated than anything else. Yeah. It's a way to kind of numb out. In fact, that's one of the 3 central motivations for addictive behavior, as I see it. One of them is to get high. If I'm feeling low, I want to get high. Another is to connect with other people. And the third one is I just want to numb out. And I think numbing out actually takes the cake. I think numbing out or self-medicating is probably the most common motivation for using. So I don't think that would be the motivation for recovery if it's the motivation for addiction. But back to this question, how do you set limits with somebody? How do you care for somebody? Can you bring the question back up there for just a second? Is it possible? Is it gone? Okay, thank you. I want to reflect on the question for just a minute. Thank you. Austin is so on it. He's like 2 or 3 questions down the road. Sorry, Austin. Thank you. Bob, think slowly. Can you say anything about keeping hope for someone who you love who's still in addiction? So here we are. How to keep hope for somebody so that they can see that in your eyes, but to not get so entrenched in that, so caught up in that it takes you out if they relapse. And you say how to draw a line in order. How do you love somebody? Hold hope for them, and also set boundaries. That's really the question. And I think the only way to do that I can see is to love with non-attachment. There's a phrase out of Indian scripture, Hindu scripture, the Bhagavad Gita. There's a phrase that goes like this: do your duty with faith in God without attachment to the fruit of your action. Do what it is you're to do. Which is to love your, in this case, love your loved one as they're in addiction. You hold hope for them. You hold love for them. I've had clients say this to me, Bob, you hold hope for me because they don't have hope. Well, I'm happy to hold hope for them until they can find it for themselves. Yeah. So we do that. We do our duty with faith in God, which is that we don't assume that we're in charge of things, that it takes something greater than ourselves, however you understand that we do our duty with faith in something greater than ourselves and without attachment to the fruit of our actions, which means it's not for me to decide what's going to happen. And some of that, without attachment to the fruit of our actions, for me communicates non-attachment, which is how to love somebody and to hold that lightly. Not that you love them lightly, you love them with all your heart. In fact, I think the only way to set boundaries with somebody in that circumstance is to love somebody so deeply with faith. You can't hold off on loving, and at the same time, the loving is what helps you provide the boundary, because the boundary is a loving act. Yeah. Does that make sense? Yeah. It's like it's in love that I set the boundary. I can't set the boundary if I can be cold and hard and dissociated, but to actually engage with somebody is to have then the wherewithal to be able to set a boundary that's a boundary in love. So-called tough love. I don't like that term because it gets misused a lot, but the idea that it's a love that isn't afraid of confronting as necessary. Does this register?
Yeah. What you were saying right now reminded me of I want to add to the part where you said that you can't change the other person. It's really their decision of whether they decide to get clean or not.
That would be the non-attachment. It's is that I can't possibly attach to what's for you to decide or for me to decide.
Exactly. And I was at Bible study last night, and somebody said something really good, that God can't change our minds for us because He has blessed us with free will, right? So He can only change our heart. So in order to change the heart, you have to change your own mind. Basically, you have to have that free will to change. And so I think that goes kind of hand in hand to what you say, that you can kind of point the finger and yell all you want, but that's really not going to do anything, because at the end of the day, it's their decision, their choice of whether they're going to change or not. So the best option, I think, is definitely just to love on them. So
I like very much what you just said, Odie. I had a flash as you were talking. There's a lot of conversation these days in the psychotherapy research on how it is that change happens, and it's talked about in terms of brain science, because there's more and more access to understanding the brain now because of brain scan technology in the last 20 years. And so, and we've mentioned it here in our show before, is that change happens as a right brain to right brain phenomenon, right brain to right brain phenomenon.
Right.
The right brain, which is associated more with connection and feeling, for example. The left brain, which is more associated with differentiation and language and logic and ideas and thinking and so on. It's the verbal part of our brain. They're both absolutely important, but the most change comes through the nonverbal. And if you think about it the way you just talked about the mind, I think most of us think of the mind as kind of a left brain thing, the mind that thinks. The heart is something different. And it's almost like the language of the heart is how change happens. And so back to the question, it seems like to me, how do I keep my heart open? Because my heart is all I can offer you, and not try to foreclose on your brain, on your mind, because I can't possibly do that. It's a little bit, I have a dear friend of mine who puts it this way, it's a little bit like going east on a westbound train. If you can picture that, as a train going west and you're going east on that train, it's like, how do I love somebody with open heart and at the same time with limits or with boundaries? Well, I think you can only do that insofar as you're open-hearted and really, as long and like you put it in the language of the mind, you have to decide to do that. You have to be willing to do that. And it's easier for most people to close their hearts. When my clients say that I have loved ones who've given up on me, while it's very understandable, what they're describing is that loved one has closed their heart. And it's injurious. It's not helpful. It's understandable, but it's not helpful. There's another comment or question here. Let's see. This is somebody who probably, if you were present last week with Dr. Bildner's presentation, she was discussing something that's relevant to this. Let me read the question and comment on it. This person says, I'm on Suboxone. It's a medication to assist somebody to be able to manage their addiction to opioids, and am currently tapering. So they're tapering off of the Suboxone. I'm also really involved in 12 Steps AA and have a therapist. Is there anything else you recommend? Well, those are all good starts. There's all good starts. First of all, that I'm assuming you're working with a physician to help you with the tapering of the Suboxone. The body can adjust with a gradual tapering, and it takes medical advice or counsel to do that effectively. Really support you in that. I myself went on a medication taper myself when I was addicted to benzos, which are sedatives, and it took 3 months for me to be able to taper off of that. And I worked closely with a physician, and it made all the difference, and I've never returned. So I support you in that. That's great. So you're really addressing the body or the medical aspect. You're also going to 12-step groups for support, which is really important in terms of the 12-step programs, particularly look at addiction from a spiritual perspective. So you're addressing the spiritual dimensions of addiction and recovery, which is great. And you're going to see a psychotherapist, and most therapists are trained to work with the psychological, the emotional, the relational dimensions of addiction. So that sounds really good to me. I feel like that's really thorough, but what you're suggesting, you're asking a question of what you might do, what else you might do. I'm going to recommend a couple of things that you didn't mention, and let's see how it lands for you. You're addressing the body, the medical end of things. You're addressing the psychological. You're addressing the spiritual. If I might suggest 2 or 3 different resources, how's it going in terms of how you're caring for your body in addition to tapering off the medication? How's it going in terms of exercise? I feel like the physical exercise is really important in terms of getting the body regulated again. I also want to ask about your diet. How's it going with your diet? So many who are recovering from addiction will end up replacing an addiction to a substance with high sugar, for example, because the way that metabolizes, and so diet would be a piece of it. There's a third piece, and oftentimes in early recovery, people who are in recovery really struggle with sleep. The sleep is really thrown off, especially around, for example, opioids. And so I'd want to check and see how you're doing with your sleep. And all three of those dimensions, exercise, diet, and sleep, are things that you could bring into conversation with your medical provider. So I feel like that's another part. Since my background's in psychology, I have a high value for your seeing a therapist. I think that's wonderful. One thing that you might bring up with your therapist and or your physician, because a lot of medical doctors are now more aware of this, is what kinds of things do you do to self-regulate? And by self-regulation, I include prayer, include meditation, yoga, anything that you can do to relax your body. As we've talked about here, stress is one common denominator as being a very primary trigger for relapse. And so anything that you can do to reduce stress on a day-to-day basis is really useful. Your therapist can help you to address relationship stressors, your emotional life in terms of regulating that. And I just really think there's a lot you can do on your own too in terms of self-regulation. And so if this lands for you, you may already be practicing something. If not, I'd be welcome you to reach out to me. I'll give you my email address at the end of the show where I can suggest some resources in terms of practicing. I believe it's really important, daily self-regulation practices, because as you address, for example, I meditate every morning, is that you begin to lower the baseline of stress, and a lot of research to suggest it's very effective, and so especially if it's regular. So I want to suggest that. And then there was one other area that I'll mention, and then I'll move on, is that I want to support you, especially in early recovery, support you in any kind of creative expression. I think of ways of kind of cultivating your soul. And this is as individual as we are people here in this room. You can be into acting, you can be into drumming, you can be into hiking, you can be into nature, you can be into any art form, basically. And art forms can be, I'm using a very broad definition of that. I really feel like that's an essential piece of moving forward also in your recovery. And want to suggest that you, that if you've had an expression, let's say, that's a creative self-expression, and lost that habit, to build that back in. And if you don't have it, I work with plenty of people that have struggled with addiction since adolescence and really never cultivated any kind of self-expressive form, is that it's not too late to begin with that too. And it's something that you could bring up with your therapist for sure, because chances are your therapist will be skilled in brainstorming with you some ideas. So those are some thoughts in terms of, I really think of addressing addiction kind of across the spectrum, and at the very least to address your body, and you're doing that physically. I suggested some other options around your physical self. I recommend good mental resources, including good reading and meaningful conversations with people about recovery. I think that creative self-expression feeds the soul. I feel like I want to support your spiritual practice, which includes the 12-step program and any other spiritual practices you have. And then you're working with a therapist to work on the shadow, which is the shadow would be all of our emotional, for example, if you come from a background like so many of us in addiction do, where you've experienced trauma that needs to be processed so that it can be cleared out, a therapist is the ticket for that. And so I feel like that's a fairly comprehensive start anyway. I hope that's helpful. One more comment or question. Okay, sometimes the consequences do not stop us, though, you know. That's like when you and I were talking about realizing the consequences, the cost it is to our central relationships. Right. Absolutely. What do you do when the consequences don't matter and the person keeps pushing through and staying actively using? Okay, well, I started one direction with that, and then it goes a different direction. I want to cover both of those. I absolutely agree, is that sometimes that still small voice just doesn't have enough traction. And it doesn't matter how much you think of those that you love and how you've hurt them. The addiction can have such a power. And as we talked about, addiction is really a subcortical phenomenon. It's in the midbrain. Subcortical just means subcortex. The frontal cortex helps us, provides brakes. And when that's offline in active addiction, sometimes nothing will work. And so that is the truth. that's where I think the earlier person who talked about attending a 12-step support group or any kind of supportive relationship, for example, with therapy, can be very helpful because you can actually rely on somebody else to help support you when you don't have it to do yourself. And so, absolutely, that's the trick. That's the task before us. But you go on to say, what do you do when the consequences don't matter and the person keeps pushing through and staying actively using? Do you have a thought about that? What do you do when the consequences don't matter? I'll put it this way: since both you and I are married,
Right.
Let's ask our wives.
Right.
What should they do when the consequences of the impact it has on our relationships with them in the past didn't matter? What should they do? Maybe they did do this,
Right.
And the addiction it has a toehold. In other words, the addiction won't let up. In other words, we stay actively using. So, what would we recommend if we were therapists to our wives or any loved ones in our lives? What would be the recommendation for them? Any thoughts about that?
Yeah, but I'm not too sure how this is gonna sound, but patience, I think, it's probably like the main thing, and something that I definitely heard from my wife during those times, and even now with minor things, of don't leave your towel on the bed, just hey, I'll get better. Just be patient. It's like, I know, that's what I'm doing. Just being patient. But
what would patience look like to your wife, do you think? If you were you're asking for her to be patient,
right.
what would you like that patience to be like around towels on the bed?
Well, the patience would be having since we're on the topic, it goes perfect, having the hope, knowing and the faith that that person will change. The patience of waiting for that moment in time when it does happen.
I was thinking of you're choosing the word patient. It's a great word. The root of the word patient comes from the Latin word passio, which means to suffer.
Okay.
For example, you've read of the Passion of Christ. It really is the suffering of Christ.
Yeah.
That's what that image is, and it comes from the same root word, patience and to suffer. And they're really, I think, actually in the Bible, if you look at older translations of the Bible, sometimes the word for patience is long suffering. Long suffering is actually the word that's used for patience.
Yeah.
And so there is a suffering quality, and we're not ignoring that. It requires a capacity to be able to suffer while you wait for your husband to figure out how to get the towels off the bed. Was that what the issue was? Okay. But you included something in that, which is it's not just blind faith, is it?
Right. Yeah.
It's really maintaining hope that you'll get it, with the idea that you probably are making progress. It would be hard for your wife to continue to have faith in you if she had no hope that there was going to be anything changing.
Yeah, exactly.
But my guess is that you are working at that. You're committed to that, and she's seeing examples of gradual growth. It's never fast enough, hence the patience.
Right, yeah.
But it'd be hard to maintain if there was no growth, right?
Exactly.
I feel that so strongly with the clients I work with who've had multiple addictive relapses, is that many of them, the ones that are really committed to change, you can tell that their attitude isn't defeat. The attitude is, okay, now I'm up against the ropes, like your earlier image. Right. Now I'm up against the ropes. I really, really want to weave in what I did wrong this time and not repeat that. I want to learn from this experience. And that's really as good as it gets for any of us.
Yeah.
We all make mistakes in our lives. So do those that love us, can they be patient? Can they suffer as we slowly turn the ship around and begin to change our behavior?
Yeah.
I like your answer. It's good. It's good. I hope that helps the one who asked the question. What to do when the consequences don't matter. We're not counseling blind faith or blind hope here.
Yeah.
In fact, we talked about this a few weeks ago. There was a Christian author, Dietrich Bonhoeffer, who was a theologian who was martyred during the Second World War, during the Third Reich. And he wrote a book called The Cost of Discipleship, and he was talking about discipleship in terms of discipleship following Christ. And you can locate this in any spiritual tradition that you happen to be in, but that he contrasts the idea within most spiritual traditions is that we are saved by something beyond ourselves. And one of the words for that is grace, is that I don't deserve this, I can't earn it, and yet there's still grace that transforms and redeems my life. And so Bonhoeffer makes this distinction between what he calls cheap grace, which would be what we're not counseling. Cheap grace would be saying, oh, I just keep suffering, and you keep forgetting what is it you do? What is it? What is it about the towels?
I leave it on the bed.
You leave it on the bed. Okay, that would be
A wet towel.
a wet towel. Yeah. It took me a while to get the image. Okay, wet towel. I turn a blind eye to that, even though it doesn't change. That would be what Dr. Dietrich Bonhoeffer calls cheap grace. It would be giving cheap grace. You really haven't done anything to earn it. And he contrasts that with costly grace. And I love that term. Costly grace suggests that both are true. It's grace because I'm being patient with you if I'm your wife. And it's costly because it requires you to be responsible. And both are true. Both are true. It's not one or the other. It's both of those. Does that make sense?
Yeah.
So that's what we're suggesting here is costly grace. I love this topic. I'm cracking up right now because we're literally at the slide where we left off 2 weeks ago. So we're moving. We're asking you to be patient with us.
Yeah.
The process of having you bring questions, I hope it's useful and I hope it doesn't feel too scattered. My sense of working in addiction recovery is that we cycle around certain seminal topics again and again with the goal of going deeper and deeper into what may be useful. And so you can let us know, but my wish is not to be scattered. My wish is to weave in everything that comes into our central direction here. And today we're talking about hope. The hope is for transformation. The hope is for healing. The hope is for recovery. What is it we recover? We recover our original faces before we were born, to put it in that format. We recover why it is that we're here. We recover the image of God within ourselves. And so everything that we address here was the goal of moving forward. And that does require patience, not only on the part of those that love us, but on the part of ourselves, because nothing changes overnight. Addiction, the root word of addiction, is addictus, which means enslavement. And we've talked about this. To be enslaved is a state of being that takes as long as it takes to unshackle ourselves, to be freed. And so we have to be committed for the long haul. That's my sense of it. I have to tell you, today in the group, right when we started the group today at beginnings, someone said, I thought when I was getting in recovery, I was just going to be recovering from alcohol. This is somebody who's been addicted to alcohol. I had no idea that it was going to require for me to change my entire life. I just laughed because I could so relate to that. Yeah. The idea is that I have to change my relationship to my emotional life. My spirituality is going to change. All of my relationships are going to be affected by this. I just thought literally it was going to be like, take alcohol out of my life and leave all the rest the same. And the fact is, it's across the board. And so to really become free from enslavement requires a radical change, body, mind, spirit, and everything else. There's a comment or question up here. This person says, listening to you, if you keep bringing up the comments and questions, we'll just stay here on this slide right here. And that's fine. That's fine. That would be just fine. That would be just fine. Let me take an aside real quickly, and then I want to address this comment or question. I've been leading groups at Beginnings for 3 years now. This is I'm going into my 4th year. And I've come in all these years. I don't think I've talked to you about this, Austin or Odie. I've come in all these years, and the outline for our weekly podcast, which I print out as a PowerPoint, that outline is what I bring into groups. And so I work this material in groups every week. So when we come to the podcast, there have been several conversations I've had with group members about whatever the topic is. Well, something's changed just towards the end of last year into this year, and I think it's manifest even in our podcast here, is I've started coming into groups. We have a technical thing, and so I'm just going to tell stories. I started coming into groups, and I did this today. I came into the group and I said, I want to invite all of you to share with me what's working for you right now in recovery. And so in the last days, what's an insight or a tool that you've gained that you'd like to share with the group that you feel like could make a difference in terms of your moving forward in your own recovery? And later this week, I may come into another group and ask the opposite question, which is, at this point in your recovery, as you reflect on your history of addiction, relapse, recovery, and so on, what's a central barrier to your sustaining recovery? And I'll ask, and there'll be a number of people that will share what's on their mind, and I'll just make a mental note of each item that people share. And then the goal of that conversation is to weave together whatever people brought up. And that's what we're doing today, is that I start with an outline. Odie and I are sitting here faithfully holding the anchor of our outline, and then comments or questions that come in are really, that's where the gold is, it seems like to me. I asked last week, people like coming to my groups, and says, what is it you like? And he says, you're the only one that leads our groups that actually asks us what we want to talk about, what's important to us.
Yeah.
And this is not to dismiss other people, because I think there's all kinds of entry points into successful groups, but I'm more and more committed to that. So in that spirit, another comment. Listening to you makes me think that hope is way more powerful when people join their hope together. In this case, my hope of recovering and not relapsing is magnified when other people have hope in me too. That is beautiful. That is beautiful. That's absolutely accurate. There's this idea in psychology of emotional contagion. If you're hopeful, and I care about you, and I care about your opinion, and my hope is ambivalent, I get a contact high, to mix a metaphor which is probably totally inappropriate in the context of talking about addiction and recovery, but I'm sticking with it, is emotional contagion is that you infect me with that. I am affected by that. A more technical term for that in psychology is co-regulation. Talked earlier about self-regulation, how important it is for us to develop ways of regulating our own selves, but we co-regulate one another to the extent that you look at me and respond to me out of your heart is to the extent to which my heart is strengthened. And so absolutely, in terms of being in the presence of people that provide hope. I'm going to do this, doggone it. We've got 10 minutes, and we're going to go through at least the next 4 slides, because I want to answer your question more fully, and it's implied in our next few slides. We've talked about what it's like, what shame does to us in terms of pinning us to the mat like a butterfly. And I want to ask you to reflect for just a second about what it's like to feel hope, and this is really related to this last comment here. What's it like to feel hope in the presence of others? The technical term for this in psychology is transmuting internalization. And I want to just apologize for that right up front. There's no excuse for that kind of language. That's not okay. Okay. But if you look at it, it can make some sense. Transmuting is just a fancy word for changing, transforming. And internalization is taking something inside. And the fact is to the extent that you're a loved one of mine and you're relating to me with your heart, and that you haven't given up, that you're being patient with me, is the extent to which I can be changed by that, because that becomes my interior world. Your attitude, your heart attitude becomes my heart attitude. That's transmuting internalization, the way that all of us can understand that.
Okay.
So back to this question and comment. We made it through 4 slides. We can move through these slides. The term that has come to me about this phenomenon is that certain individuals can be hope mirrors for us. Hope mirrors. That's really not a phrase, so that's why I can use it. And I actually have an image. Can we bring up an image there? Can you believe that I found this image online? that people can hold up hope to us, and what they do is they mirror to us our own hope. And even if our own hope is very, very on the brink of being snuffed out, somebody holding up a hand of hope, somebody holding up a heart of hope, they mirror that hope within us, and we can internalize that. And so that's my sense. That would be a more adequate answer, I think, to the comment here. This person said, listening to you makes me think that hope is way more powerful when people join their hope together. In terms of mirroring back hope that we collectively were much stronger, much more fortified. In this case, my hope of recovering and not relapsing is magnified when other people have hope in me too. You know those mirrors that make your hand bigger? It's like that. It's like my hope becomes bigger because the mirror of you bringing that to me is way bigger than mine alone. And so let me ask a question. We'll do an exercise and we'll wind up for today. Can you think of somebody in your life that is a hope mirror, somebody who holds up hope for you? If you're in recovery from addiction, somebody who continued to see you and believe in you,
Mm-hmm.
your wife, other people that you care about, or any other domain of your life, somebody who's significant in your life now or maybe historically. If you can if you can locate that, can you remember what that feels like? Can you feel what it's like to be in the presence of somebody who mirrors back hope to you? What does that feel like in your body and your soul? Let's talk about that, and then I'll wrap up. Let's talk about just that. Can you think of somebody who mirrors hope, and what does that feel like? Do you mind sharing?
No.
And I'll share an example.
Yeah. I remember the earlier stages of recovery. I met up with somebody that at first I didn't know was struggling with the same thing.
Okay.
Not at the moment, but after talking to them, I opened up to them. They opened up, and they told me that they've been 5 years without anything of pornography.
Okay.
And so just hearing that, I was like, oh, well, in the group before, it kind of seemed like everybody around me was just kind of struggling with it still.
Yeah.
So just hearing from somebody else that, hey, it's been 5 years and I'm good, so it's possible. So just
that's beautiful.
hearing that and having that, I was like, okay, so this it's possible to defeat this thing. So I know that's with him and going to these groups, it's possible to continue on that path of sobriety, so to speak.
That's perfect. That's a beautiful example. Thank you. That's great. That's great. That's a perfect example of being in recovery from any addictive behavior and finding somebody who's preceded us. It's the logic behind all of the self-help support groups is that you're with people across a whole spectrum, from people who are very, very early, first day in recovery, to people that have been at it, like you say, for years and years. There are two examples that came to my mind as I was thinking of this, and neither one of them has directly to do with current recovery, but I think they're pertinent because of the dynamic, and I think in that way they're wedded. I've mentioned before my 6th grade teacher, Miss Todd, was very significant to me, and as I've shared here before, she was my first experience in a sustained way of an adult really mirroring me. I didn't have those words for it at age 11, but I felt very seen by her. And I remembered just this week that I got my first F in math or anything in Miss Todd's class. I was working in the cafeteria, and I was she let me do that because I had to leave early from math class, but I got behind, and it finally caught up with me. I got an F. I saved that F paper for years and years and years. I think it got lost in one of my moves over the years, but I saved that F. I think it might be the only F I ever got, but it's the most significant F, and I'll tell you why it was, is that Miss Todd gave me an F because I failed the math test. And I still remember, it's going to be hard to talk about this without crying all these years later, I still remember her sitting with me and her saying, I know that you're capable of much more than this, so let's figure out what we can do to help you succeed. That's all she said. It was like, so I got my first F, which would be devastating, except that it wasn't because of the way she handled it. Does that make sense?
Yeah.
And I've never forgotten that. I don't know that I remembered that over all the years of saving that F paper, but I think that's what was behind it. Flash forward a few years, the second very significant teacher in my life was Mr. Hayes. He was my high school German teacher. And I can still remember it was actually exactly 50 years ago. This fall. 50 years ago this fall. It was the fall of 1969. I know that's right after you guys were born. You guys were very young then. 50 years ago, I was in a German class. I was in the language lab. And you sat in these individual carols with these little headphones on. And you practice with a microphone. You practice, in that case, speaking German. And he could be up there in front and listen to each person, kind of pipe in as you went through these lessons. And I was way back and I was in this carol behind a glass kind of wall or whatever like that, separating me. And I thought I was safe to do this. So I opened up a little packet of cornets. Do you know what cornets are?
Yes.
Those little things. And I didn't do speaking of math, I didn't do the math on this, is that I'm chewing on cornets. And if you know what a cornet is, it's very noisy. So he's going to be able to hear me because he
Yeah.
can pipe into anybody. And so I'm sitting there and I'm secretively munching on my cornuts as I'm practicing my German. And all of a sudden there's a tap on my shoulder. I didn't notice that he had left up front. There's a tap on my shoulder, and Mr. Hayes looked down at me. Now, here's an opportunity because it was not okay to eat in class of any kind. He looked down at me, and I'll never forget what he said to me. He said, "Bist du hungrig?"
Are you hungry?
You speak German.
No.
That's exactly what he said. And I'll never forget the relief of that. Rather than shaming me or punishing me, he just said, "Are you hungry?" And I'm sure I was beat red. I was so embarrassed. I was just like, oh man, I got busted with my cornuts. But I never forgot that. And so in both cases, Miss Todd and Mr. Hayes were able to reprimand me or to set a boundary. We talked about that earlier. No eating cornuts in class, Herr Weathers. F's aren't okay, little Bobby. But in both cases, they were able to help me to the next level, which is to facilitate change without shaming me. And so those are two examples that came up historically. And so all those years ago, those lessons have stayed with me, which gives you an idea that some of these interactions, like the one you just shared with me, they're unforgettable. What we're able to experience with Hope Mirrors leaves a lasting impression.
Yeah. Perfect.
Let me suggest this in winding up. Two things. First of all, may I suggest if you have somebody like that in your life, Mr. Hayes and Miss Todd are gone now physically. I interact with them in my prayer life regularly because of my quiet time and my meditations and so on. So I feel like they're very present with me. They're very present with me today, if not literally, at least spiritually, internally, heart-wise they are. And we can do that. What can I do to increase contact literally with people that are hope mirrors? And also internally, heart-wise, even if I don't have access. Maybe you have access to this person, maybe you don't, but it's kind of immaterial because we have a way of engaging with people, whether they're materially present or not. So let me suggest that as one suggestion. The second suggestion is this, and I'll leave this with you. Since I'm a teacher, this is your homework assignment, and that is, I want to encourage each one of us to be a hope mirror for somebody else this week. There was some research done at Harvard some years ago looking at the self-help movements, particularly the 12-step movements, and looking at from a psychological perspective what tends to be what's the most transformative, what's the most healing in the 12-step movement. And because it was a psychological study, they weren't going to look at spiritual factors like the higher power concept. They would leave that to theologians and so on to talk about. But they came up with two factors that across all 12-step support groups seem to make such a huge difference. One of them is the term universality, and that's the idea that, like you said, when you're talking to somebody who knows addiction from the inside, specifically the addiction that you struggled with, it makes such a difference. It's like there's an immediate communication.
Yeah.
I feel this exactly when I'm working with individuals recovering from substance addiction. I know it from the inside. They know that I know it. And so it's universal. It's in the room. It's universal. The second healing factor that was mentioned was altruism. And it's built right into the 12-step process, and you know this from your own experience, and I do too, which is you're asked to pay it forward. You're asked to give back. So if you've experienced healing with this man, you will turn around and give that to someone else. And the same for me. And so I think what we're talking about here today is not only be grateful for those in our lives that have been hope mirrors to ourselves, but can we find a way proactively to give that back to others and commit to doing that this week? That's our homework. The good news of altruism is that in my giving to others, I'm pretty sure I'm the greater beneficiary. Is that it's in the giving that we receive. And this is held in high esteem in the 12-step movements. It's held in high esteem in spiritual traditions. And I think it's really important for our recovery that we find ways to be able to give back. And here's a good way to give back, to be a hope mirror. I got freaked out. I could not have Recovering Hope Part 3. I could not do that. Thank you guys for being with us in an interactive way and being patient with us today. It's wonderful to have you with us. Thank you, Odie, for your contributions today, as always. Austin, thank you for your participation today and being an excellent moderator of the comments and questions. Thank all of you who joined us today by listening, by contributing in whatever ways that you did. We really appreciate your contributions. Next week, speaking of restoring hope, we're bringing a firebrand. This guy is great. Paul Bartlow is going to join us next week. Paul Bartlow is going to be talking about the 12-step programs, and he'll be speaking from personal experience, and he speaks from his heart, and he has got charisma flowing out of every pore in his body. I love this man. And he'll also be speaking, very possibly, about he and I are participating locally with a physician with an innovative approach to detox from addiction that includes a psychological component, which is the part that I bring, and a 12-step recovery component, which is the part that Paul brings, along with a little bit of what I was talking about earlier in terms of a comprehensive approach to the healing of the body, not only medically, but also in terms of practices like good diet, exercise, and so on. So Paul will be bringing all of that next week. We'll have a vital engagement, I'm sure. And I look forward to you joining us next week. We'll be back in a couple weeks back to Odie and me here. I don't have the topic set for that yet. We'll come up with that. I promise you it will not be Restoring Hope and Recovery Part 3. We can all be grateful for that, right? Thank you for joining us today and making it fun, okay? If you have any final questions, and I think I asked this earlier, the individual that I responded to with your questions about resources, additional resources for recovery, I wanted to invite you to reach out to me directly. You can reach out to me at my website, drbobweathers.com. Just send me an email there. You can find it under the Contact Me section, and I'm happy to respond. You can also write to us through Ask an Addiction Specialist and or the YouTube channel that we have. Let me suggest this, is that if you liked what we did today, please do a couple of things. One is access the archives of all of our previous episodes. We have over a year now in the can, so to speak, of everything imaginable about addiction and recovery. You can find that archive at Ask an Addiction Specialist on Facebook. You can go to YouTube and look up Ask an Addiction Specialist. It'll be there. You can go to Beginnings Treatment Centers and go to the archive of podcasts, and you'll see the whole library of resources there. And also like us. I know you do like us, but like us. Like us online. And I'm saying that in honor of Austin in terms of promoting what we're doing here. Appreciate very much your support. Invite friends to join us as you have this week. And know that you're always welcome, okay? We'll see you next week with Paul Bartlow. We're signing off for now. Thanks for joining us. Thank you all. Take care. Good week to you.